Let's go there. I feel like people, like, what is the secret sauce? You show up in the ER. How do you get shit done? Because I feel like most people show up in the ER, and if you've never done it before, it's a war zone, especially in America, right? It's like, what's the protocol?
Wait, Kate, you're saying it's different than Australia?
Well, it's been 10 years since I've lived in Australia, but Australia has, I would say, a better medical system than America.
And you're saying specifically in the ER?
My experience has been, yes. The ER here, it's bad. You show up and it's like people are dying and they're not getting seen. That's how it feels. I don't know if that's actually true, but it feels really disastrous in there.
It is chaos. Yeah. And depending on which ER you go to, there's a variety of chaos, but it's generally chaos everywhere. I will say, like, I haven't worked in Australia, but I did spend some time working in New Zealand in the emergency department there. And it was extremely different. Mostly with the degree of providers, physician, and nurses to patient ratio. It was much different. Whereas in the States, on a regular shift, doctors are seeing like 30 patients a day. Whereas in New Zealand, you'd see maybe 10. So 3x the level of effort over the same time frame. So it's chaos. You're not as much putting out fires as you are just trying to stop the speed of the burn. And then there are some fires where obviously those fires require all of your attention. The severe traumas, the sick patients, the people coming in cardiac arrest, those are the ones that require all the focus. And then the people with the chronic illnesses that you're not really going to do much with, you just try to make sure they're not dying. And then you send them off to go back and see their regular physician. So it's hard to describe, but it is chaos for sure.
So, like, Mike, if a loved one showed up in the ER, what would you recommend to them? I just had this. My mom just had an eye issue and she showed up in the ER. And it's like, what do you do? How do you advocate for yourself in the system when the system has its own procedures? So what would you give a recommendation to people?
Like ER friends are going to kill me.
Exactly. Exactly. We need them behind the scenes.
Yeah, I would tell them to. Honestly, I would throw your complaints into an LLM and ask it what should be happening, and then make sure that happens for yourself. If I'm
like, we should blur Mike's face,
right,
and then change my voice and be like, we just referenced an anonymous source who's an ER doctor at some prestigious center.
Doctors always talk about how much they hate it when their patients Google their problems and then come to them with questions about their Google problems. But like, that is such an active form of advocacy for yourself. And it's honestly so important in our system because our system is so broken. So if you're not asking the questions, you're going to be placed on that easy path. And it's going to be the easy path for the physician, for the nurse, for everyone in the system, because they're getting destroyed. They're getting like absolutely murdered on a day-to-day basis. Chances are good that they're burnt out. And if you're not advocating for yourself, you put yourself in a challenging situation.
Yeah. And I feel like that stigma around Googling things is valid because we have this like cognitive bias toward catastrophe. And so when we research something and it has the possibility of cancer, we go down that path, as opposed to, I feel like ChatGPT, when I've interacted with it from a healthcare position, it actually gives me really reasonable advice. It's like, well, if you want to, it's probably these things. In the really rare cases, it's these things. It's much more it feels more informed than obviously just Googling something.
Yeah, I think the challenge is it's going to give you good advice based on how good you are giving it information, right? So the quality of which, if you're giving it, I feel like because I know the right questions to ask, if I give ChatGPT all of the symptoms that somebody is presenting with and all of the positive, negatives, and all those things, it's going to give me great responses. I don't know if that's true for someone who doesn't understand physiology or medicine quite as well. Are you going to get as quality of responses? I can't say that that's true or not, but we do know that ChatGPT, for example, has performed better than physicians now on standardized tests. So in situations where things are quote unquote standard, we would expect it to do well. Life is rarely standard, but interesting world.
Yeah, what I ended up doing with my mom was I had her on the phone and I had ChatGPT up and I said, treat me like a patient and do an intake with me, ask me my symptoms. And I just went back and forth. And so on the phone with her, I was just asking probably 100 questions. And eventually it came back with here's what I would do. Here are the exams I would do. And then she went off on her way on her Disneyland ride.
And Kate, did you get resolution to that?
Yeah. So she didn't get seen in the ER by an ophthalmologist. And so she went then to an optometrist and got exams. And ChatGPT essentially correctly diagnosed that it was some inflammation of the eye, scratching of the cornea. She's now on, I think, eye drops to resolve it. So